Get ready for a steamy night. Urologist analyzes ashwagandha's impact on your sex drive. You won't believe the results. What if I told you that there's an herb that reduces stress and boosts testosterone by 15%? Is it for real, or just a fad? So, if you like what you see, make sure you subscribe and share this channel with your friends. Today, we're going to talk about ashwagandha. What it is, how it works, its side effects, and the data on sexual function in women and men, for testosterone, libido, fertility, and erectile function. If you decide after this video that you do want to take it, stick around to the end to find out how to take it, what time is optimal, what dose, and what to look for. Ashwagandha, known as Withania somnifera, is an herb that grows in India, the Middle East, and parts of Africa. It's often used in Ayurvedic medicine as a natural stress relief, immune support, anxiety, and depression remedy. So, how does it work? Well, it contains active compounds called withanolides, which are believed to have a variety of health benefits. Specifically, they're thought to be anti-inflammatory and may have some antioxidant properties. It's also classified as an adaptogen, meaning that it essentially helps the body cope with stress more effectively, specifically in both short-term and long-term physical or mental stress. The way it works specifically is by reducing cortisol, a marker that our body releases when we are adapting to stress. Side effects can include dizziness, sleepiness, headaches, nausea, or other GI symptoms like vomiting, diarrhea. There have been rare cases of liver injury and, generally, some emotional blunting and a lack of finding pleasure in everyday activities. This is because it works on a number of different pathways, including serotonin pathways, which are often part of our pleasure pathways. It can also interact with blood pressure medications or anti-anxiolytics like benzodiazepines, and you definitely don't want to take it if you're pregnant, trying to get pregnant, breastfeeding, or on any sort of immunosuppressive medication. If you have type 1 diabetes or any sort of thyroid disease, you want to avoid this supplement. Also, it can have a blood-thinning effect. It's actually considered a nightshade plant, so if you are allergic to nightshade plants, which can be plants like tomatoes, eggplants, potatoes, and peppers, you want to stay away from this. Let's start with how this affects sexual function in women. In 2015, 50 women were randomized to receive KSM-66 ashwagandha, which is a water-based extract, or a placebo made of starch. They took these at 300 milligrams twice a day, daily, for 8 weeks. What they found was that there were significant improvements in female sexual function, specifically in arousal, lubrication, orgasm, and satisfaction, and overall, their sexual distress score was lower. They had a greater number of successful sexual encounters. Moving on to fertility in men, there have been 2 studies that looked at 5 grams of ashwagandha root powder given to infertile men. Again, these are really small studies, and this is only looking at specific semen parameters, not specifically leading to live births, which is actually what matters when you're looking at infertility. In the first study, they had 68 infertile men between the ages of 22 and 40. They all had a sperm count that was somewhere between 5 to 20 million per milliliter, had other abnormal semen parameters, and had been trying to conceive for at least the last year. Then, they looked at these men before the study started and then 90 days later. They found that with the ashwagandha root powder, there was a significant increase in sperm concentration, which was actually almost 167%, from 9 million to about 26 million. They also saw significant increases in semen volume, as well as sperm motility, after day 90. Interestingly, they also saw a serum testosterone increase by about 17%. The reason they think this works is because, as I mentioned earlier, ashwagandha is an antioxidant. When thinking about infertility, the reason a lot of men often have issues is because the environment of the testicles, which produce testosterone, may have a lot of antioxidants. So, the antioxidant properties of ashwagandha may be helpful in this respect. Another study looked at infertile men who were also heavy smokers and noted to be psychologically stressed. They again gave them the same 5 grams of the root powder for 3 months and found again that they had an increase in sperm count, as well as motility. In a second study, they did a similar process with a number of men who either had abnormal semen parameters with infertility or also had psychological stress and infertility, to see if this improved. And in fact, again, they saw in this very small study that there were some improvements in sperm concentration, as well as motility. The takeaway from this about infertility is that it may be helpful, but we really don't have enough data to recommend it widely. Again, the issue with any of these supplements is that we don't know what they put on the bottle is actually what's in the supplements, because there's very little regulation of supplements. And again, these studies only looked at people for up to about 90 days. So, what happens if you take it longer than that? Do you still see benefits? And the other issue is that when you look at sperm parameters in general, there's variation even from person to person, from day to day, as well as if you've had a cold, the flu, or something else that can affect your temperature, that can also significantly reduce your sperm concentration. So, what about erections? In men who had erectile dysfunction, there's really only been one human study that looked at psychogenic erectile dysfunction. If you want to learn more about that, make sure you check out my video about psychogenic erectile dysfunction. These men took 2 grams of ashwagandha root extract with meals for 60 days, and ultimately, they found that they really didn't see any difference in erectile function. Let's talk about testosterone. I already mentioned in the infertility study that they saw an increase in testosterone. In another randomized study, where they looked at men getting 240 milligrams of ashwagandha extract with 35% of withanolide glycosides, they were looking at how it affected cortisol and DHEA, but as a secondary outcome, they looked at testosterone. They measured this at the start of the study and then 60 days later. What they found was that after those 60 days, there was a 10% increase in testosterone levels in the ashwagandha group. However, when comparing the changes between the placebo group and the ashwagandha group, they were actually not statistically significant, meaning while the numbers increased, it wasn't any clinically different than the placebo group, and likely the change was just due to chance. Other studies have looked at specifically stressed men, as well as men who were also undergoing a resistance training program, and saw some improvements with testosterone. But as we know, stress and testosterone are very much correlated. If you have higher levels of cortisol, that inhibits testosterone production. So, if you reduce cortisol in a stressed individual, you should see improvements in testosterone. If you're not stressed, maybe that benefit won't be so obvious. As I mentioned previously in my video about testosterone, exercise, resistance training, particularly of large muscle groups, do result in increases in testosterone. So, in that other study that looked at men who had a resistance training program, who knows if it was from the ashwagandha or the resistance training? Lastly, what about libido? Well, we know again ashwagandha reduces stress, and when you have chronic stress, it obviously causes sexual dysfunction and reduces your libido. There's actually been no human study specifically on libido. However, in animal studies using moderate doses in mice, they saw reductions in stress, as well as more sexual activity in those who were chronically stressed while taking ashwagandha. However, in an alternative study, they actually saw a lowering of libido because they gave a large dose of ashwagandha, 3 grams per kilogram, which may have been a sedative and maybe made the mice more sleepy. Again, the data for these sorts of supplements is really all over the place and not very strong. However, if you have none of the contraindications I discussed earlier in the video, are interested in trying it, and have the income to try it, then by all means, it's okay to do so. Just make sure you talk to your doctor about it to make sure there's no contraindication to any of the medications that you're on. So, when do you want to take it? Well, you don't want to take all your cortisol first thing in the morning, so you want to take it ideally in the afternoon and the evening. The majority of the studies looked at a 300 mg dose, and you want to get the highest percentage of withanolide glycosides within that ashwagandha extract as you can. Also, the majority of these studies were 8 to 12 weeks, so if you're going to take it during times of real stress, like when you're having a stressful time. Take it for a short period of time, 8 to 12 weeks, no more, because we don't really know what preventing cortisol production over long periods of time will do to your body. And lastly, because it's a supplement, you want to assess the supplement. Make sure it undergoes third-party testing, so that what you're getting in the supplement is actually what you're taking, and try to investigate if that particular supplement has undergone some studies of its own, rather than just pulling studies generally about ashwagandha. The bottom line is, ashwagandha may have some health benefits for stress reduction and potentially improvements in female sexual function, testosterone, and maybe infertility. But we need a lot more studies to really confirm that this is actually true. However, we do have wonderful treatment options for low libido, low testosterone, infertility, and erectile dysfunction. So, if you are experiencing any of those things, make sure to see your local urologist, infertility specialist, or sexual health expert to help guide you with evidence-based medicine that can really help. As always, take care of yourself, because you're worth it. See you in the next video.